it's gone, and I got no place to go.
This is Democracy Now!, democracynow.org, the War and Peace Report. I'm Amy Goodman with Sharifa Belkadous.
Well, we continue our look at healthcare in foreign countries. We're going to turn now to Canada. In a moment, we'll go to Toronto to hear from physician and health policy analyst Dr. Michael Rackless. But first, we turn to the words of Tommy Douglas, a Canadian politician who helped usher in Canada's single-payer system. As Premier of Saskatchewan, Douglas pioneered a number of progressive policies there, including the expansion of public utilities, unionization, and public auto insurance. But his biggest achievement was the creation of universal health insurance, called Medicare. It passed in Saskatchewan in 1962, guaranteeing hospital care for all residents. The rest of Canada soon followed, province by province. In 1983, 3 years before his death, Tommy Douglas spoke about health care at the 50th anniversary of the founding of the Cooperative Commonwealth Federation, his longtime political party.
When you go back to your constituency and you run into somebody who says it's a good idea for you soft-hearted humanitarians, but we can't afford it, let me give you a simple statistic which you can put down on a piece of paper and carry in your head. And that is that our friends in the United States are spending 9% of their gross national product. And they get a higher per capita gross national product than we do. They spend 9% of their gross national product on health care, and 34 million of their people have no health care coverage. And in Canada, we spend 7% of our gross national product, and every man, woman, and child in Canada is covered under Medicare. If you want a two-tiered health program, then just continue the way we're going. And I remind you that in this movement we pledged ourselves 50 years ago that we would provide health care for every man, woman, and child, irrespective of their color, their race, or their financial status, and by God, we're going to do it.
That was Canadian politician Tommy Douglas speaking in 1983. 11 years later, a nationwide poll conducted by the CBC earned Tommy Douglas the title of the greatest Canadian. Well, let's look at this country, the United States. America, 2009, 18,000 people have died in 1 year, an average of almost 50 a day. Who's killing them? To investigate, President Obama might be tempted to call on Jack Bauer, the fictional rogue intelligence agent from the hit TV series 24, who's invariably employing torture and a host of other illegal tactics to help the president fight terrorism. But terrorism is not the culprit here. It's lack of adequate health care. So maybe the president's solution isn't Jack Bauer, but rather the actor who plays him. Yes, that's right. The star of 24 is played by Kiefer Sutherland, whose family has very deep connections in healthcare reform. That is, in Canada. Take a listen to Kiefer Sutherland.
Hi, my name is Kiefer Sutherland. Many of you may know me as well, but there's something in my background that you may not know, something which I am very proud of. I am also a grandson of the late Tommy Douglas, a premier who brought enormous change to Saskatchewan and the rest of Canada.
Yes, that's Kiefer Sutherland, the grandson of the late Tommy Douglas, the pioneering Canadian politician, the premier of Saskatchewan, who helped usher in the modern Canadian healthcare system. We turn right now in Toronto to a doctor who is very important in this system, Dr. Michael Rackless, physician and health policy analyst, also adjunct professor in health policy studies at the University of Toronto. His latest book, Prescription for Excellence, How Innovation is Saving Canada's Healthcare System. We welcome you to Democracy Now! What does our debate look like on your side of the border up north, Dr. Rackless?
I think I can say that across the political spectrum in Canada, almost across the political spectrum, we're quite appalled at the level of the debate in the United States, and in particular, what's being said about our country's healthcare system.
You know, when Tommy Douglas pushed through universal health care, single payer in Saskatchewan, he had a major opponent the U.S. American Medical Association, who led a strike of Canadian doctors in Saskatchewan. Despite this more than 3-week strike, universal health care, single-payer system in Canada was instituted first in Saskatchewan, then adopted all over. Explain the system as you have it today.
Yes, and I think that there are many misunderstandings, unfortunately, about our system, and I should make it clear that my intention certainly isn't to push our system on your country. You'll have to make your own choices, but I am trying to clear up some of the misconceptions. Our system evolved over the same time as you were making decisions about your system in the 40s, 50s, and 60s. We initially had hospital insurance in Saskatchewan under Douglas in the 1940s. Then in 1957, the federal government brought in a hospital insurance program, which led the way for other programs after it, in that our federal government is not responsible for health care. It is the provinces by our Constitution, but the federal government provided money to the provinces if they met certain terms and conditions for their insurance programs, and one of them was universality. All the provinces bought into the federal hospital program in '57, and then that, because Saskatchewan then had some money from the federal government for their hospital program, they were able to push ahead to medical insurance in 1962, which wasn't as popular with physicians as the hospital insurance program, which is why, as you mentioned, physicians did go on strike. But the strike was settled, and a federal government royal commission in 1964 recommended Saskatchewan's style of medical insurance for the whole country, and the federal government passed their medical insurance legislation in '66, enacted in '68, and then all provinces had bought in by '71. In parallel, in your country, Truman almost launched a national health insurance program in the late 40s, defeated by a concentrated AMA lobby. And then in the 1960s, you grappled with whether to go to universal program, but ended up with 2 programs for those populations that the private insurance system wouldn't cover, the elderly and the very poor, your Medicare and Medicaid programs. So in Canada, our national health insurance program, again, is a mandate from the federal government that if the provinces want the federal money, they have to meet certain terms and conditions. But as opposed to being so-called socialized medicine, like in Britain, excuse me, where the government employs the doctors directly and owns the hospitals through the National Health Service, in Canada, almost all doctors are in private practice. And although it varies from province to province, in the largest province, Ontario, with almost 40% of the population, all our 160 hospitals are private, although not for-profit entities. And the government program pays for care for whatever physician or hospital you choose, and that's another myth in the U.S. debate these days, that we can't choose our doctors or hospitals. In fact, we have completely free choice of physicians in this country, and wherever you go, you take your Medicare card with you, and then the government will pay the bill.
And Dr. Michael Rackless, you recently penned an op-ed in the Los Angeles Times where you outlined 5 lessons of the Canadian system for the U.S. system. Can you go through them?
Yes, the first couple of lessons have to do with the it's economics 101. That is, that if you have a single-payer system like Canada has, and virtually every other wealthy country as well has some variation of either a national health system like the UK, or more commonly a national health insurance program like France and the Nordic countries, etc. If you have a single-payer system, when you don't have to have thousands of actuaries to set premiums, or thousands of lawyers in your country to deny care, there's huge savings on administration, both within the insurance system, but also in doctors' offices. A recent report in the U.S. said over 6% of all doctors' revenues are spent on billing and reconciliation. The Massachusetts General Hospital has more people working in their Billings and Reconciliation Department than we have at the Ontario Health Insurance Plan head office to administer health insurance for 13 million people. So all through the system, there's increased administration. And so Canada spends 10% of its gross domestic product or national economy now in healthcare. You folks are spending 16%. Half of the difference is due to the increased administration of insurance, and the other half is due to the fact that a single-payer system can negotiate much lower prices than multiple payers in your system. And so about half of the rest of the difference